telling us about different agents that are, I guess, a newer class of agents.
There are a newer class of agents that are effective in bipolar disorder that actually were first started in use in other disorders in psychiatry, but are increasingly proven to benefit bipolar disorder as well. And some of them are quetiapine, olanzapine, aripiprazole, which are marketed in the United States as Abilify or Zyprexa or Seroquel, and other names now that most of them are off patent and can be available very inexpensively. Well, if a patient with bipolar disorder is prescribed a compound like one of those and looks at the drug prescribing information, he might see that this compound is good for schizophrenia and good for anxiety disorders or panic disorders, and that is true too. So some of these compounds are useful in several classes of disorders, just like I mentioned to you, valproic acid and carbamazepine are used in epilepsy and in bipolar disorder. So this newer class of compounds has some advantages and disadvantages. They have some disadvantages in causing weight gain, more than lithium and more than carbamazepine, and that can be a problem for bipolar patients. I'll tell you a little bit more about weight and appetite and sleep in a few moments. But they have some advantages over lithium and valproate and carbamazepine in that they do not require frequent blood tests. Patients taking lithium or carbamazepine or valproate need to have their blood levels checked. And so this might be no problem at all for a person in Manhattan. But in a rural village in India, that might be hard to get those blood tests. And so these newer compounds do not need that, and they can be used with a wide range of doses. But again, we should not think that they can be only used when the person is depressed or manic. They need to be used preventively in a long-term way.